Hey guys, Dr. Christina Coblish here at Upper Cervical Chiropractic of Boulder. Today I want to talk a little bit about one of the most common things that we work with here in our upper cervical practice, and that is vertigo. There's a couple things with vertigo that I want to cover today. The first is what is vertigo and what are the signs and symptoms. I also want to cover how the treatment of upper cervical care relates to vertigo and why the upper cervical spine and misalignments there can play any kind of effect on someone presenting with the symptom of vertigo. So first, let's cover what is vertigo. Vertigo is a condition where someone feels uneasy or unsteady or as if the room is spinning when their feet are level on the ground. Unfortunately, people suffer with vertigo at all different times of the day. Sometimes it's when they first wake up and then get out of the bed in the morning. Other times it's when they're driving. Sometimes it's when they're standing still. And usually it's an exhausting symptom that we can't find a lot of patterns or connection to. And those suffering from vertigo feel incredibly frustrated. Now, spinning is not the only sign or symptom of vertigo. Vertigo can also lead to other things like headache, nausea, and vomiting due to the feeling that your body is spinning or moving. By itself, vertigo is not life-threatening, but I'm sure if you or someone you know suffers from vertigo, you know that it plays a huge strain on their life. It can be exhausting and debilitating for some. So let's talk about how the upper cervical spine can affect vertigo. While there are a lot of different potential causes of vertigo, one of the most common reasons that we find that our patients have vertigo here in our upper cervical clinic is an upper cervical misalignment right behind the inner ear. While there are a number of possible causes of vertigo, one of the most common reasons is inner ear dysfunction. And here in our upper cervical clinic, we have found that upper cervical misalignments very close to the inner ear play a really close role into people who experience vertigo and people who have misalignments in their upper cervical vertebrae. Your inner ear is a part of your vestibular nervous system, which helps your eyes take in information and coordinate where your body is and its surrounding environments. If you have a vertebrae in your upper cervical spine that is not in proper alignment, it causes inflammation around the structures of your inner ear. And over time, this inflammation can lead to buildup of fluid in your eustachian tubes, not allowing them to essentially function properly. This inflammation in the inner ear and the fluid stuck in your eustachian tubes can lead to the transmission of signals not being sent to and from the vestibular system throughout the rest of the body to function the way that it should. And this is where we find the imbalance start to take place in our patients. If this is left untreated, for many patients, this disruption of the vestibular system due to inflammation in the inner ear coming from an upper cervical misalignment over time can often lead to vertigo. And we see it in here all the time. We also help patients here alleviate their vertigo symptoms all the time. So let's talk a little bit about how upper cervical treatment works and exactly how it helps alleviate vertigo. The technique we specialize in is called the Blair Upper Cervical Technique. There are a few different types of upper cervical techniques. Blair is one of them. It is the one that we have found that has worked best for our patients. But really, we support all forms of upper cervical care in helping alleviate upper cervical misalignments to help restore balance in the system. And that's really what upper cervical is all about. Essentially, restoring healthy function back to your upper cervical spine. We use lots of different diagnostic tools to make sure we are being as precise and specific as possible when we adjust and analyze this area. One of the most important things that we do here is we take a picture of your spine, and we don't just use traditional standard x-rays. We use a CBCT, which is often found in dental offices, and it renders a 3D model that is dynamic of your upper cervical spine. So we can see exactly where your bones are in relationship to your central nervous system and your vestibular system. And we even get a picture of your inner ear and your jaw, and we can see how any misalignments in this area might be contributing to soft tissue inflammation or any kind of fluid buildup in your inner ear. Through this process, we're able to figure out the most effective course of action to restore the alignment and the function of your upper cervical spine and your vestibular system. If vertigo is something that hits close to home for you and you've never had your upper cervical spine at least evaluated by an upper cervical chiropractor, I urge you to come in, start with our imaging, talk to both myself and Dr. Ryan, who is here. We are both upper cervical chiropractors that practice the Blair Upper Cervical Technique, and we would really love to see if what we do can help alleviate your upper cervical symptoms. Thank you so much, and we'll catch you in the next video.